Pleasure. Please go.
Okay, good afternoon, Professor Noakes.
Hi, Murray. Thanks for involving me. Good to see you again.
Thank you for agreeing to be interviewed. I'm going to start, if I may, with some questions to you.
Please go ahead.
So the first question is as follows. In the past 10 years, you've written that certain dietary trends or choices can lead to certain conditions or illnesses. You've advised that these can have considerable health implications. More lately, we know that COVID-19 hospitalizations and deaths in the Western Cape have several common comorbidities. These include diabetes, hypertension, and obesity, to name just a few. Furthermore, obesity is recorded to be prevalent as a comorbidity in a very, very high number of all hospitalizations and deaths. That's the context. These correspond almost precisely with the conditions that you have written about as caused by dietary trends or choices. Can you elaborate?
Sure, Murray. The reality is that there's one comorbidity. They're not comorbidities. They're all the same condition. And I mean, that's what we've been speaking about for the last 10 years, that the underlying condition is insulin resistance, which is an inability to tolerate carbohydrate. And every time we eat carbohydrate, we over-secrete insulin, our glucose goes out of control, and ultimately over 10, 20, 30 years, we develop obesity, diabetes, hypertension. But the underlying cause is insulin resistance. And the problem is insulin resistance is not even taught at any single medical school in the world. So you have to ask, why is this condition that is so prevalent? In fact, it's estimated that something like 80% of Americans will become insulin resistant by the age of 65. Why is it not taught in medical schools? So the problem with talking about comorbidities is it's not, they're all the same condition. It's all insulin resistance, and the treatment is the same. Now, when I wrote Real Meal Revolution with my co-authors in 2013, we didn't know that type 2 diabetes is completely reversible. We didn't know that type 2 diabetes is a behavior disease determined by what you choose to eat. And if you choose to eat the wrong foods, then your insulin resistance will develop all those conditions we described. However, if you choose to eat less than 25 grams of carbohydrate per day, you can put your type 2 diabetes into remission. And in some people, it actually can be reversed. So we know what to do to reverse all those conditions, which now are the substrate on which COVID-19 acts so terrifyingly for many people. And it's really interesting because no one will say anything about it. Well, why not? Why won't people just be honest and say, there's one condition, insulin resistance, when associated with a high carbohydrate diet, puts you at risk of a fatal COVID-19 outcome. That's all we're asking for people, particularly the politicians, is just acknowledge it and just say, okay, we didn't get it right last time. We were warned that insulin resistance is a big problem. And we fought the people, we fought scientists like myself, we've been saying it for 10 years. Now it's time to say, okay, let's declare a truth. We were wrong.
Are you saying that for a significant number of people, lifestyle choices, in other words, dietary choices, has preceded the COVID crisis and is now something of a perfect storm in which you have a large number of vulnerable people who are particularly vulnerable to this particular pandemic?
Yeah, I don't think there's any argument about that. The clear evidence is that in South Africa, diabetes is the major risk factor. Something like 50% of people in the Western Cape who've had poor outcomes from COVID have type 2 diabetes. But again, I want to make the point that the diagnosis of type 2 diabetes hides an underlying group who have marked insulin resistance. If we were to test them in modern day techniques, we would find that the majority have diabetes. So the 50% is an underestimate of the role of type 2 diabetes in this condition. So I think there's no question that this is the perfect storm, where you've got this virus which works most effectively in people who have type 2 diabetes and high blood glucose levels. And it's been shown that in the presence of a high glucose, the virus is more likely to bind to the cells and then reproduce itself. What is more, the protein that it binds to is damaged or made more accessible by prolonged high blood glucose levels. So that this high glucose levels for a long time just makes the virus more attractive, or the cells more attractive to the virus. And then finally, obesity, which is an inflammatory state, makes it more likely that once the virus takes hold, you will have this inflammatory storm, because you're obese and your cells are inflamed and more likely to respond inappropriately. So that's the background. And even now that we've only been 3 months into this epidemic, the evidence is clear that that's the truth, and that people who have high blood glucose levels do much worse. So we're not even talking about having frank diabetes, but having higher glucose, you'll do less well with this virus. Now, what's really interesting is that we can get your glucose under control in 7 days. 7 days, you can take a recent onset diabetic, put them on a low carbohydrate diet, 25 grams a day, and a very low calorie diet as well. And within 7 days, you can normalize their blood glucose. So if people were really concerned, they would say, right, what we have to do is take the people who are most at risk, those are people with type 2 diabetes or pre-diabetes, and we've got to take all sugar out of their diets. We need to take carbohydrates out of their diet and see what happens, because the prediction is that they will have a much better outcome if they are to get the disease. The other point I need to make is that there's growing evidence that vitamin D deficiency is a key factor in having a fatal outcome. And the mortality just shoots up when you have the lowest vitamin D levels. And I'm not hearing anyone saying that. So if I had any advice to a government facing this crisis, I'd say, right, you've got to see that the people who are vitamin D deficient are taking vitamin D either as a dietary supplement or increasing the content of fish and other high vitamin D substances, foods, into their diets. And then secondly, I'd say, and we've got to cut the carbohydrates and the sugar, and tell people that that's the way you're going to make yourself more resistant to this disease, even if you currently have type 2 diabetes or profound insulin resistance. There's something you can still do.
Just to be completely clear, you believe that people who may be particularly vulnerable to COVID-19 have actual steps that they can take in a very short period of time to make themselves less vulnerable?
Yes, I'm not suggesting for one moment that there's any proof that this will prevent people from getting COVID-19. That's not the case. The case is that we know the way the virus acts in people with type 2 diabetes and high blood glucose concentrations. And we know that people who have lower glucose, even if they have insulin resistance, are going to do better than those who have higher blood glucose levels. So a logical extension, which has not been scientifically proven, I'll make that point, is that you've got to get your glucose under control. That's the first priority in this condition. Get your glucose under control and see if that won't make a difference, but not to tell people that. And why don't we tell people that? It's almost as if we're scared to tell them, listen, being overweight and having type 2 diabetes is a problem, and we've got to resolve it. And it's not shaming people. The reason why people get type 2 diabetes is because they haven't been told what to eat. They haven't been told that if you're insulin resistant, you can't afford to eat carbohydrates and sugars. They've not been told that. They've been told you must eat 7 to 11 servings of grains every day, and that's causing the diabetes. So we can't blame the people. They've doing what they're told to do. We can blame the people who are giving them that advice and who continue to give them that advice because we know it's wrong and we have to change. But let's tell the people this is the truth. We're sorry we told you the wrong evidence for so long, but to help you survive this crisis, this is what we think you should do.
Is it possible for people who need to change their diets to do so, to eat the right foods, even if they're operating on fairly small monetary food budgets? Is it actually possible to do so?
Well, thanks. That's a great question, because once I started promoting the so-called Banting diet, people asked that very question. So we put money into the Noakes Foundation. We're a small organization, and we have run at least 12 interventions in the poorer communities in Cape Town and elsewhere. And we've shown that people can live on the Banting diet, get sufficient calories and sufficient nutrients from a diet that costs 30 Rand a day. Now, I appreciate that there are many people who cannot afford 30 Rand a day. But what we're trying to show is that you don't have to spend 300 Rand a day eating steak. You can spend 30 Rand a day looking for the really healthy foods that are cheap. Eggs, pilchards and sardines, offal, vegetables, dairy produce. If you build your diet around those foods and not around rice and potatoes and mealies and maize, you can start to put this condition under control. So, but what's remarkable is no one's interested. No one will promote this idea. It's again, here, and we have done clinical trials, and we've got one currently ongoing, which show that people's health gets better on this 30 Rand a day diet. And you would think that in this country, the people, the government, etc., would be saying, gosh, you've got a solution. Why don't we adopt it? But it's like, no, you can't do that for some reason.
People who have underlying conditions which have become prevalent comorbidities in this crisis, when they visit their doctors, is it your view that enough doctors are speaking about nutrition as an action that their patients can take?
No, unfortunately not. And it's not the doctor's fault, but the doctors aren't trained in nutrition. They train to prescribe drugs as the core treatment for conditions. That's how medicine currently conducts itself. You have a condition for which there's a drug which you prescribe. And nutrition is simply not on the agenda. And tragically, the nutrition has been left to the dietitians who've been taught a dogma for the past 30 or 40 years. And it's not their fault either, because the dogma came from medicine. It came from medical scientists and from governments like the US government, who said that we must eat this high carbohydrate diet to be healthy. So I would not blame the dietitians. I would not blame the doctors. But the reality is they're being given the wrong information, and they're not being told that you can't treat a nutritional disease such as diabetes with drugs. It doesn't work. You have to get to the cause. And only when you get to the cause, which is this high carbohydrate diet with lots of sugar and lots of vegetable oils, so-called seed oils, you have to take all of them out of the diet, and then you start repairing the body and you start to heal.
Finally, just on a general basis, not on a patient basis, on a general basis, if somebody was to be concerned about their weight, or about that they had hypertension, or they had diabetes, what are the 3 or 4 explicit steps that you would recommend in general that such people take?
You know, Murray, that's a great question, because the answer is so simple and people don't get told it. You see, they get this long story about counting calories and exercising vigorously and cutting down on the sugars perhaps, but eating more cereals and grains and avoiding fat. And that unfortunately just makes you fatter. There's only one thing you have to do to control your diabetes, control your obesity is you have to control your food cravings. That's it. Control your food cravings. And we've shown it in our own research, and it's coming out globally. What happened with the dietary change that begins in 1977, when the US Senate committee comes up and says we must replace fat in the diet with carbohydrates, essentially, was that the producers of food had a problem because the taste from the food comes from the fat in it. And once they removed the fat, the food tasted of nothing. So they had to do something. And then they discovered sugar was a good substitute. And then they soon discovered that sugar is addictive. And that's the key. Sugar is addictive. And what they did then was to provide more and more sugar in the foods and make them more and more addictive. So what happens if you're eating a standard healthy, prudent diet, low fat, prudent, heart healthy diet, is that you're forever hungry because the diet is full of sugar. And that addicts you to want to eat every 3 hours. So we're told to eat 6 meals a day or something, which is nonsensical. Humans are designed to eat once or twice a day and to starve for most of the day. And that's the key. So what people need to learn is you've got to find the foods that take away your food addictions and your cravings. And as soon as you get control of your cravings, you can eat infrequently, your calorie consumption goes down, your obesity disappears, and your diabetes improves. That's the key. And just to give you an idea, we looked at 28 people who had read the book, The Real Meal Revolution, and claimed that they'd reversed their diabetes or brought it under control. And we examined them and found that 21 of the 28, it was actually true, their diabetes had improved dramatically, and some had gone off all medication. Now, we know from other studies that it is possible to put type 2 diabetes into remission, so that wasn't the surprising. What was surprising was that the key differentiator from those who benefited from the diet and those who didn't was the ones who got control of their food cravings. They also said, our attitude to food is completely, utterly changed. We now eat infrequently, we eat big meals, we're satiated, and we're not hungry for 16 hours. And so we only need to eat one big meal a day, and then we can have a few snacks. And that's the key. You cannot get healthy in moderation, eating the standard diet in moderation. It doesn't work. You have to find the foods that completely satiate you. And I just wish that people listening to me, and particularly professionals in the medical profession or in dietetics, who are eating 3 or 4 times a day, would just say, I'm sure Noakes is wrong. I'm sure he's talking nonsense. But let's see what happens if I cut the sugar and the carbs. Let's see if he's right, that I become satiated and I'm not hungry all the time, and I can stop eating frequently, and I can start eating twice a day without feeling hungry all the time. Just do that and see what happens. And if it works, you've solved the problem. You know what the issues are. Otherwise, you go back to the literature and you have the industry telling you that sugar is not addictive and you can eat in moderation. You can't. The diet that is being prescribed to South Africans is highly addictive, and continuing to eat it in moderation will not solve the problems of insulin resistance, type 2 diabetes, and so on. The only diet that works is one where you get away from the addictive eating patterns.
My last question, it's been said by a number of people that the COVID pandemic is going nowhere anytime soon and may be with us for 6 months or a year or 18 months. Is it therefore your contention that our relationship with what we eat could be one of the most important factors in surviving this pandemic in the medium term?
I completely agree with you. And the only short-term vaccination that we have that's going to work is a diet, is this diet. You may well be able to vaccinate yourself against risk by eating this diet. So that's what I hope happens. I must put in a point of hope, is that it appears that the virus is getting less active in certain countries like Italy, that once the virus has passed through humans enough times, it starts to lose some of its virulence. And there is a feeling that the virulence of the virus is getting less. And let's hope that that's the case. But regardless. If it stays as virulent as ever, your responsibility to yourself and to your family is to look after your health and to get rid of the obesity, to get rid of the diabetes, get your blood glucose under control. You have a personal responsibility to do that for your family, because if you don't, you remain at increased risk.
Thank you very much, Professor Noakes. I think you've concluded that very neatly. Is there anything else you'd like to say?
No, Murray, just thanks a lot. And, maybe this is the final tipping point where people will realize that what you eat is crucial to your health. And what you have to eat is relatively simple to remain healthy. It's not rocket science. It's relatively simple, but we need to get the message out, and the public needs to demand that information, because for some reason it's not percolating down from the top. In everything I've done, we've come in from the bottom, and we've tried to educate people about ways that they can make themselves more healthy. And it would be fabulous if people at the top would start saying, repeat what we're saying to the general public, and saying, actually, this is the solution.
Thank you very much for your time. I'm very grateful to you.
Pleasure, Murray. Thanks. It was a great interview.
Thanks again.
Thanks so much.
I'm going to